And we're literally seeing an epidemic of these issues in the United States right now.
Dr. Robert Melillo is the co-founder of Brain Balance Centers.
1 out of every 10 children in the United States now is diagnosed with ADHD, and that's a real increase.
My name is Dr. Robert Melillo. My life's mission is to help kids and families with special needs. My wife, Carolyn, makes it all possible. Welcome to our family.
Hello, welcome to our show. I'm Dr. Robert Melillo. This is always my beautiful wife, Carolyn. And so we want to start again with what's in the news, and this is actually a really important week. We're here in April, and April is Autism Awareness Month.
That's right.
And April 2nd actually was World Autism Awareness Day. And it's very important because one of the things that came out shortly before was that the CDC just released its most recent statistics showing that autism is now affecting 1 in 68 children or 1 in 42 boys born in the United States.
It's unbelievable. It's really, I mean, are these numbers real? Are they being overdiagnosed? I mean, what is the story here?
Yeah, and that's the question that, you know, the CDC and a lot of people have been saying, well, it's just that we're diagnosing it more. But, you know, I really looked into this when I was writing my book, and the easy answer is that probably about 50% of the increase is actually due to improved diagnostic awareness and all those other things. But at least 50% is a real increase. We're seeing more people. And New Jersey, where we're here, is 1 in 45. It's the highest in the country.
But why New Jersey?
You know, it's a really good question. I mean, it's a beautiful state. Obviously,
right.
There's great things going on, but it's really the New York metropolitan area. So we know that stress and lifestyle has a lot to do with this. So, you know, it's hard to say exactly why, but we know that there are environmental factors that are driving this.
So they're not genetic, because there's a lot of talk that this is a genetic disease,
right.
And it's not genetic then.
Right, no. What we see is that you couldn't see going from 1 in 10,000 to 1 in 65 in basically 3 decades as a genetic mutation. So it's clearly environmental factors, and it has to do mostly with a lot of lifestyle issues more than anything else. So maybe,
which is a good thing, because if you know what's causing it, then you can prevent it. So if you
exactly
right. So and your book,
right,
Autism, has all the clues and keys to what to do.
That's the reason why I wrote the book. One of the things about that is that we also saw a study that just came out in the New England Journal of Medicine the same week, showing that basically autism starts in the womb and even in the second trimester. So this is pretty conclusive evidence. It's something that, again, I've said and other people have said for a while, but this one thing tells us that the question of, does something like vaccines cause it, kind of answers that, because it's already happening.
So it's really important for people to know that, because there's so much that they can do before they even think of getting pregnant to prepare their bodies, both men and women, because people think it's only the woman, but certainly the man too needs to be at a certain weight.
Right.
Is that not correct?
It's men and women. We know that a recent study just showed that men who are obese also have an increased risk of about 150%. So there are these different things.
And women too, and this is a really sensitive issue, because everybody says embrace yourself, embrace your weight, but really that's okay if you're not reproducing. But if you're going to carry a child, weight in male and the female has a lot to do with the onset of autism. Is that not correct?
Absolutely. Yeah. Another good study though that came out on the good side is that different companies like Freddie Mac and other companies are now actually specifically trying to hire people with autism.
Which is great news, because people worry so much, what's going to happen to my child when I'm gone, or when I'm, will they go out in the world, will they be social,
will they
have a job?
Yeah, will they be independent?
So that's really great news.
And it also highlights the fact that many of these people have unusual gifts. So, I know that in regard to that, we had something from Twitter, I believe.
Oh, okay. Let's look at the Twitter. Do the numbers, as the numbers change, from 1 in 80 to 1 in 68, I'm afraid to have a baby. I don't know how parents stay so strong.
This was really the reason I wrote my most recent book, because, Billy, my nephew, had actually come back from a weekend and said that a group of his friends, 30-ish, really, sophisticated, smart yuppies, had been saying that they weren't going to have children because they were afraid of having a child with disability, and that's a tragedy. So the reason why I wrote the book is so that people understand that by understanding risk factors, by understanding what you can do, by avoiding risk factors, you can take control of this and maybe even prevent yourself from having a child with autism or some other disability. So stay tuned, because when we come back, we're going to be talking with one doctor who's helping making air travel for children with autism a bit less stressful, and more when we return. As we go to break, take a look at the screen. The Autism Cares Foundation Gala is happening on May 2nd at the Hyatt Bellevue. For more information or for tickets, go to their website, autismcaresfoundation.org. Welcome back. I'm Dr. Rob Malillo. I'm here with my wife, Carolyn. Our next guest is making flying and life in general less stressful for children with autism and other disabilities. Last year, Dr. Wendy Ross, who is the director of the Center for Pediatric Development, partnered up with United Airlines to introduce her air travel program, and she's here now to talk more about it. Welcome very much, Wendy, for being here.
Thank you for having me.
So Wendy, how big of a problem is this in the autism and special needs community?
Well, from my perspective, I was hearing it from pretty much all of my patients.
Wow.
And I feel like a lot of the resources go to the cause and the cure, but when I was seeing parents, they were wondering how they were going to do their activities tomorrow and what was going to happen when they were gone one day.
Sure, sure.
So you're a developmental pediatrician, medical doctor, and you've been in practice for many years. So what was the first thing that got you to be interested in this? Or
Right, well, I guess I was hearing from my families that they weren't going out, and I started with museums, working to make them more inclusive. And then I had a patient that got stuck on a flight home from Disney World because the airline wanted her to pre-board with just one parent, but that wasn't how we prepared her. So that's how the AIR program got started.
so how would an airline deal with issues when a crisis like that?
Well, I think the first role of all of us actually is to prevent these crises, right?
Right.
So one of the first things we do is we prepare the community and we educate them about autism and make them more sensitive, and we provide them with strategies as well as providing families with strategies.
How easy is that to do? I mean, what, do you go to the museums and the airports? I mean, how receptive are they to this information?
Well, I'll be honest, initially it did take some convincing, but now more and more when they get feedback from the families about how much it helps them, people are really excited to do it.
So this is a big problem in the community. What happens when a child does actually have an outburst? How do you give the parents tools or techniques?
So we do a lot of work on the front end to prevent the problems by having families prepare, by having organizations prepare, and by having families practice with the support of clinicians. If families do have an issue, we still err on the side of preparing. So we have families go to a quiet area and calm down. We make sure that people in the community are asking the parents how they feel they might help them instead of just sort of jumping in. Or what a lot of parents are afraid of is the judgment of other people.
Sure.
So I think that's a big thing to try to prevent that and have people just be patient.
Okay, well, thank you. We have a Twitter question now from Vincent A. O'Keefe. Some old school card games help, especially if batteries on devices die. Also paper and pencils for hangman, Mad Libs, etc. What do you think about that?
Yeah. Well, I think absolutely, like any parent, again, you want to prepare and always have things in your bag of tricks to help keep your child comfortable when you're traveling. Activities, snacks, things like that.
Great.
So is there any, real main tools that you could give to our audience that, some things, obviously it doesn't replace coming to you and working with you and your staff, but are there some tips that you can give them that the parent now, tomorrow, if they're going to go on vacation, what should they be doing?
I mean, absolutely, because the goal of the program is to have families be independent. So we do it on a large scale, but families can absolutely call an organization and ask how they can prepare their child, ask for pictures. They can write their own social stories to prepare the child. And in the instance of an airport, they could ask for a practice experience to show up, and as much as people can, even if it's just security, I believe that people would be willing to help them.
What do you said an important point. What do you mean write a social story? Meaning they literally sit down with the child and write a story as if it was going to happen?
Right. So one of the things that we do, and now, which is really exciting, we're working with the sports teams,
Right,
is
that's
we
great.
write stories. These stories were created by Carol Gray, who's a very experienced educator and psychologist in autism. And they tell you what's going to happen in a social setting and what your expected response is. And they're really short. you know, if somebody's at the Phillies game going to come sit in front of you, you need to either stand up so they can walk by you or move your legs aside.
Right.
Oh,
The
that's
basic
wonderful.
things that other kids just socially get, that our kids with autism or any social disability need explained to them ahead of time.
Ahead of time. So that's really the key, knowing
Yeah.
things ahead of time,
Absolutely.
and what to expect.
Right.
And I think it's just fantastic because I know that you have a number of airports now involved with it, and you've worked so hard on this, and you've worked with hundreds of families, and that's great. And I know if people want to get in touch with you, that your organization is Autism Inclusion Resources.
Right. And our website is www.autismir.com.
Okay, great. Okay. Dr. Wendy Ross, Director for Center of Pediatric Development, thank you so much for being here. And what you're doing for people is really important work.
Very
this is really
important.
something.
I mean,
people
there are
should,
so many more kids out there that you don't realize how many families probably don't go on trips or don't take their kids out in public because they're so worried about the stigma or being judged or the outburst. So
And
this is really important.
Especially the kids that might look typical, like they don't have an obvious disability, but they have a social disability, like kids with autism and ADHD.
This is
Okay, well,
wonderful.
thank you so
Wonderful.
much.
Thank
And
you,
when we
Wendy.
come back, we will meet with one mom whose daughter was diagnosed with processing delays in the form of ADHD. Their story when we return after the break. Welcome back to the Dr. Rob Show. Joining me now is the mother of a young girl who is diagnosed with ADHD. Patty Gephardt is mom to Elena, and she's here now with me. You know, we love to meet with parents because other people can relate to your story. So tell us the story of Elena and, you know, the journey and the struggles that you've gone through.
Okay, well, first I have to say she started out as an infant. She was typically developing, and everything seemed fine and good. So she got a little bit older, about 2 years old. I started seeing some issues. You know, there was a lot of toe walking, and she fell a lot. Her coordination, fine motor skills were not there. She had trouble staying in one place or focusing.
And she was language delayed, right?
Very language delayed.
Right.
And especially noticeable when we would do the play dates in the neighborhood. All the other kids were building stuff and had a crayon, and she was putting stuff in her mouth and in a corner, you know, by herself.
And all those things are really pretty obvious. Like toe walking, for instance, that really shows a neurological developmental issue. And it's not a heel problem, it's not a foot problem, it's not a leg problem, it's a brain problem. Now, did you raise these issues to some of the professionals that were seeing her, like pediatricians?
Absolutely, because to me it was like, people thought it was cute. And so there's nothing cute about your kid falling and hitting their head every day.
So were they concerned at all? Did they
No,
validate your
they
concerns?
took her foot and they moved it around and said, you know what, that's something kids do and they'll outgrow it, not to worry, give it some more time, everything else seems good.
But you had an older son, so you knew this wasn't normal.
Right, he didn't do this, yeah.
But they weren't listening to you. So what happened? I know that when you went to put her into kindergarten,
Yeah, there were some real issues because, you know, of her hyperactivity. She was pretty much all over the place, pretty much a distraction. They couldn't get her to sit still or focus, and they pretty much told me, listen, if you want her to stay in this environment, you're going to have to medicate her.
Right, and your husband wasn't happy
Oh,
about that.
no.
But eventually you got to get her into school, right? So you started medicating her, and how did that work out?
Well, that was very a struggle because different medications she had reactions to. It didn't work. It was too harsh. She was a zombie. She was, you know. And then we did find a medication that finally worked for her, but it was a long, hard struggle.
Right.
It was a lot of tears.
You said she started getting some OCD symptoms, which sometimes, you know, is also a side effect of medication. Tourette's and OCD can come about from that. So now I know that you went on and you tried a lot of things, right? Like you went to OT, PT.
Oh yeah, she got it in school, and we also did private because I'm thinking more is better.
Yes.
You only get so much in the school. And so we did the occupational, we did the physical therapy, we did the speech, we went, did tutors.
Right, because she still wasn't reading by 5th grade,
Still wasn't reading.
Wow. Did any of those things really make a significant difference?
They really didn't.
No.
You know, and I wasn't sure of what the problem was because I went through, they were all referrals. So
Right.
it was a really,
Right.
these people were supposed to be really great at what they were doing.
Right, and I'm sure they are, but it's
Right.
not. You have to write the right combination. So
Exactly.
eventually, you found the right program, which is good news, and you found
Right.
out about brain balance. You found out about my work in the
Yes.
hemispheric-based program, and you enrolled her in there.
Yes.
And so, how's that turned out?
And it's been like night and day. I mean, I can't say enough. The progress has really been it's so impressive, and we're just so happy. I mean, she's conversational to us. She can tell us her thoughts. She's more, inclusive in the classroom. You know, she's just a whole different little girl. You know, who's got things to share. She's funny. She's,
Yeah, and she's doing better academically. In
academically,
school.
she's
Teachers
doing
notice
so
it?
much better. Yes, she's reading better. She's following directions better. She's able to stay on task in a classroom setting, sitting.
Wow.
Well, there's a lot going on, and she's able to sit there and raise her hand when
Right.
called on.
Well, I think the really take-home message here is that you tried everything, and not everything is going to work. But if you keep on persisting, you find the right program. And I know that you had told me that you were kind of told that there's no hope, right?
Pretty much, people were saying, like, good luck to you.
Right. Someone just patted you and said, "Good luck." Yeah.
Yeah.
And so, you persisted, and again, that's a credit to you. It's great that our program was able to help you and help your daughter, more importantly, because her whole life will be different at this point. But
yeah.
what would you say to other parents?
That you know your child, and you can see these glimpses of them that no one else sees. And you know that they're in there somewhere.
Right.
And there's a lot of information that you can get out. It's just finding the way to do it. I just say, just don't give up that there is a program.
And never lose hope. Right?
Never
so
lose
thank
hope,
you so
absolutely.
much. I really
You're
appreciate
so
you so
welcome.
much for being here. Thank you for the story. Don't go away, because when we come back, spring break is just around the corner. Ahead, we'll show you some unique comic books and crafts that may help keep your little ones entertained when we return after the break. Welcome back to the Dr. Rob Show. Our next guests are Dave Kot, the founder of Autism at Face Value and the scriptwriter of Face Value Comics, which happens to be the first comic book to feature an autistic hero. And the artist for the comic book is Preston Sky Owen. Welcome very much, guys. This is very cool. I'm a big comic book fan. So I know that we were talking, and you got involved with this personally, really, because you were a therapist, and you're also diagnosed with autism yourself, but you've
Yes.
been a therapist and worked with kids for years.
Yes.
And then you got this idea because of social stories. So tell us about that.
Yes, what we do is, well, first and foremost, we believe that all kids need and want heroes like themselves. So we give a level of credit and compassion and dignity to clinical diagnosis of everything from autism to depression to anxiety. And we use facial feature recognition in our comic books. Readers can look at a character on the page, find a static frozen feature, look at the language and the speech bubble to understand what that character is genuinely saying, and then understand in the context of the story how that person may feel, what led up to that behavior, and what consequences those behaviors may be.
So that the idea of the social stories then led to the idea of doing a comic book with that.
Yes.
And then you had that idea, and then you found this gentleman who's the artist.
Yes.
And you heard about what Dave was doing?
Absolutely.
And what piqued your interest?
Well, when I received the directions from David and his wife Angela, she was the one who sought me out. He wanted characters to portray certain aspects of the human personality. And when I started designing the characters, he became enamored with my designs, and I was so infatuated with the stories. They were so intriguing that I couldn't just stop with just the characters. I wanted to actually help him tell this story.
Well, that's beautiful. This is the comic book. This is the first edition. So tell us about the comic book itself and why it's unique.
Thank you. The opportunity for kids to have something that they can hold and access for a relatively inexpensive price that's targeting them and their story, their experiences.
By then you mean that there are specific heroes with disabilities.
Yes, yes. That readers can go ahead and look. It's not a collegiate textbook. It's not another therapist or doctor or teacher. they can use this comic book to begin to understand how they feel and other people also feel like they can be or how they have been in the past.
And you actually have a superhero who is autistic, is the first one, right?
Yes.
What's his name?
It's going to be the Zephyr.
The Zephyr,
Yes.
that's fantastic.
The idea behind the Zephyr is a rather long and complicated story, but the idea that characters can do a lot in our futuristic steampunk world. They fight in our futuristic world. We've cured cancers, we've other diseases, solved economic problems, but the biggest problem we still face is prejudice and misunderstanding.
Well, that sounds very true, and so you know, people will put the information up where people can find out. They can get these at stores. What we're going to do now, though, is now we're going to toss over to Carolyn, who has some unique and fun craft ideas for kids.
Thanks, Rob. You know, with lots of kids off for spring break, you're probably looking for stuff to do with the kids that's easy. My little friends Isabella and Trevor are here with me too, and we're going to show you some fun things to do at home with your kids that doesn't involve TV or computers. So here we have Isabella. What are you building? Yes, we have marshmallows and toothpicks, and believe it or not, your kids will sit for hours and make a lot of different molecules, and I mean, these are so cute. You could actually hang them from the ceiling, you can paint them, you can glitter them. We also have here tie-dye, which is a lot of fun to do. It's a little permanent, and I don't want to ruin your pretty dress here. You take a pillowcase, you take old shoes, you take daddy's t-shirt, you take whatever you want, you spray this on, and you stick it in the dryer, and it's permanent, and it's adorable. They can do their sheets, they can do their curtains, they can do anything. Most importantly, have a craft box always ready. When the kids are home and they're sick or there's a break or you don't know what to do with them, go to the dollar store, get magic markers, get sparkles, get glue, get paint. Always have paper on hand for the kids. It doesn't cost a lot, but they would much rather sit and do crafts than sit in front of the TV, I promise you. And one more note, this is casein and gluten-free, so if they want to munch on these marshmallows, all the best to them. Anyway, guys, what do you think? You're having fun? Do you like this? Yeah. Yeah, give it a big yeah. Okay, I'll do it. Anyway, back to you, Rob. Thank you very much. Good job, guys.
Okay, so we're gonna say goodbye to Dave Kot from Autism at Face Value and Preston Sky Owens. Thank you so much for joining us. What you're doing is great. Really want to pursue this more, and love to hear more about what you're doing for future stories. I hope people look this up. They can get you online,
yes,
and in stores. And again, what I want to say is on behalf of myself and my wife, Carolyn, I want to thank you so much for watching. We'll see you next time. Remember that there's always hope.